The topic of today is related to how technology is being used during this crisis. And, and as any technology, it can be used in a positive way and in a malicious way. The positive way, the good uses of technology have to do with several different technology. First of all, the most obvious one is the use of technology to sequence the genetic code of this virus. Just to give you an idea, in just 1 month, once the virus was detected, we were able to recreate the genome sequence of the virus. To compare with SARS in 2003, it took more than 3 months to do it. Why was it important? Because once the genetic sequence is known, researchers can start to work on the virus. They can recreate synthetic samples, but they can also share the knowledge about how the virus spread and also try to trace and monitor this virus. Artificial intelligence has played an important role in sequencing this virus, but also for other uses, for diagnosis. AI can read thousands of MRI and CT scan in a few seconds with high levels of accuracies. And also, our era is characterized by the creation of lots of data, and AI is really good for going through all this data to help scientists also to cooperate and develop new cure for this disease. AI also helped in minimizing fatality and optimize disease management. AI was used for developing testing devices, and in the future, we might be using AI to predict epidemics. Not just AI played a role, but drones have been used as well for surveillance purposes, but also for informing citizens about area that they would have to leave, or to remind people not to leave their homes. Some companies are also using drones for delivery purposes. Robots have been used, notably in China, to deliver food, medicine, and other supplies to patients, as well as to help people working in hospitals. 3D printing has been used to develop masks or spare parts for masks. Our mobile phone, as well as our computers, have been used extensively for connecting us together, to provide company with e-services, business continuity, for students to be able to learn online, for the medical people to be in contact with the patients, but also for all of us to be able to socialize. These good uses have also been counterbalanced by bad uses of this technology. Especially in the field of cybersecurity, we have seen a rise in hacking activities, especially targeting people who are the most vulnerable. Most people in times of crisis will lower the guard in terms of the information that they consume, as well as the hygiene they have when it comes to the cyber hygiene. And we've seen attempts at phishing, at social engineering, even targeting hospital, which is quite dramatic. Espionage also been used through cyber security means, has been reported that governments have tried and used this time also to spy on other governments. One of the most important negative uses that has been noticed by the United Nations is the rise of the spread of disinformation through what we call infodemic, which is the ability to provide a lot of misinformation or disinformation and rumor about a specific crisis that basically overwhelmed the good information. And finally, the use of surveillance, which is good for tracking the virus, also run the risk of being used afterwards. And this raises ethical concerns into the safeguards that we should put in place in order not to favor more authoritarianism in the future. To discuss these various issues that are highly important, we have an excellent panel today of experts in the field. We'll start by listening to Clarissa Rios, who is research associate at the Center for the Study of Existential Risk at the University of Cambridge, and also a associate fellow at the Geneva Center for Security Policy. Then we'll move to Dr. Ricardo Chavarriaga, head of Confederation of Laboratories for AI Research in Europe, and also associate fellow at the GCSP. My colleague Robert Dewar, the head of cybersecurity at the GCSP, will talk more about cybersecurity issues that have been raised by this crisis. And then Ms. Lening Pedron, president of ICON, an NGO based in Geneva, will talk more about digital trust, as well as the way hackers have been operating during this time. She's also member of the EPFL Innovation Park Foundation. Lastly, Marcello Ianca, who is working at ETH Zurich in the Health, Ethics and Policy Lab, will talk more about the ethical issues related to surveillance and the guidelines that we have to implement. Without further ado, we'll start with Clarissa. Clarissa, the floor is yours.
Thank you, Jean-Marc. I'm gonna share my screen, just a second. Okay, can you see it now?
Yes, thank you.
Yes, perfect. Okay, thank you so much for the invitation. My presentation is gonna be focused on how technology is being used for good in the health sector. And what I want to start saying is that it's not that new technology has emerged, but exciting and promising technology has been repurposed for fighting COVID-19. And during this presentation, I'm going to be talking about 5 different problems and how technology is fitting into helping with it. Problem number 1 that you also mentioned was that there is a lack of equipment to treat COVID-19 patients. So here it is when 3D printing, which is a process used to build three-dimensional objects from a computer-aided design model, steps in. And you may have seen the use of 3D printing for a miniature of your Harry Potter character, but also you have used 3D printing for building space habitats, which are the ones that are going to be sent to Mars, as you can see in the NASA competition that took place last year. And what is happening now is that 3D printing is being used to build oxygen masks and ventilators that are being distributed at the hospitals. The problem number 2 will be that there is not enough testing kits for COVID-19. So what is happening now? What can we do? So that's what many people working on the field has been wondering, and they have realized that by merging CT scan and MRI scan, which is technology that allow us to take photos of different organs in our body, and when you merge it with artificial intelligence, that, as you may know, it's a computer system that is able to perform tasks at higher speed and in a really high magnitude, together with machine learning, that is a subset of AI that provides a system with the ability to automatically learn and improve from experience without being explicitly programmed, we are having this, which you can already see at the hospitals in China, where we have CT scan being used for the prediction or to see the intensity that the COVID-19 is having in patients. And with the power of artificial intelligence, we are generating more studies on all the pictures, and then every time it becomes more and more accurate to detect if the patient is suffering from COVID-19 or not. Problem number 3 will be, how do the COVID-19 virus function? And this is such an important task because in order to develop vaccines or treatments, we need to understand how the virus is shaped. So in this diagram that I'm showing you, I just want to bring your attention to the blue parts, which are known as spikes, and they are in the surface of the virus. And it's understood that this is how the virus go into the human cells and open the cells in order to deliver their genetic material. So here we have two different technologies that are coming together in order to do protein prediction. Protein, we mean like a little piece of the virus that can be used for developing vaccines or treatment. And the first technology is sequencing technology, which, as Jean-Marc mentioned at the beginning, is a technology that allows us to read the genetic material of any species, and in this case of a virus. And together with deep learning and neural networks, which is also a subset of AI, that has networks capable of learning and supervised from data that is unstructured and unlabeled. We have companies, artificial intelligence companies, that are now putting their services into fighting COVID-19. How? Because by using computational predictions of these structures of the virus, then we can have a better understanding for scientists on how to develop drugs, medicine for treating it. You have to think about this in the same way, like how is the position of your body when you want to open a door is different than when you are hugging your dog. So in that case, it's important to know how is the virus positioning itself to open up the cells to deliver the genetic material. In terms of vaccines, which is what everyone is talking about nowadays and pushing scientists to go forward on this, we know that developing vaccines take years, even decades. So what are the technologies that are jumping now into the news and that we are hearing about as a new solutions? So in this case, I want to present you with the platform, the company Innovio, who is trying to come out with a vaccine that they call DNA vaccine. And in this case, we have 5 different technologies coming together. The first one is sequencing, so reading the genetic material of the virus. The second one is computing modeling, because we need to know which part of all the genetic material of the virus will trigger an immune response, which one will be better to make further research on it. And then, as Jean-Marc also mentioned, synthetic biology comes in because we need to synthesize chemically this DNA in the lab in order to produce large amounts and use it to deliver a little piece of the virus that is not viral, that is not going to provoke a disease into the human bodies. So how do we do this? We use recombinant DNA. What is it? Recombinant DNA is when you join together the genome of 2 different species. So in this case, what we're going to do is to take a little piece of the virus and insert it in a little piece of a bacteria. They both are not pathogenic. And then we put it together and we make a circle, as you can see on the presentation. But now, how do we make it to go inside the cells? It's not enough that you just put it inside the body, but you have to make sure that they are going to be delivered inside the cells to produce antibodies. If you remember, the immune system is based on antibodies, which are like the parts that are going to recognize the viral part, and then they are going to say to the body, okay, red alert, we need to do something to destroy this virus. So they are doing it with electroporation. Electroporation is a technology that where you apply electrical field in order to make the cell to open. And you can see everything that I have just described in this picture from Innovio, which is, this is the virus, we read the material, we choose a part that is not going to trigger a disease, we put it inside a piece of bacteria, and then we use this applicator that you just are going to come to your arm and inject it in order to generate an immune response. And this technology has received backup from the Bill and Melinda Gates Foundation, and it's ongoing, and probably during the summer they are going to be developing, or we are going to know what's happening with that technology. Another type of technology that I also would like to talk about is the one presented by Novavax. And the different layer that they apply to this process that I have just mentioned is that they are going to use nanoparticles technology. So let's come up again. We sequence the virus, we do computing modeling, DNA synthesis, and when we go to the stage of recombinant DNA, instead of using a bacteria, this company is using insect cells and another virus to infect the insect cells with the COVID-19 and then use it as a factory to produce little pieces called antigens that are the ones that we need to put in our body for our immune system to recognize and then have this memory And then next time that you are infected, they know how to proceed. So as I mentioned, they have an extra layer to this technology, and it's the nanoparticle technology. Nanoparticles are small particles that can be used for different purposes. And for this technology, they are being used to shape the three-dimensional structure of these antigens and making it more a better, like they are enhanced. So they trigger a best and longer immune response. And as you can see on the news, Novavax is going to start the first phase of human trial in mid-May. So that means they are going to have a subset of population and going to try this vaccine and see how it goes. The last problem that I would like to talk about is like, so while we are waiting for the vaccines, what do we do in the meantime, right? So we have to develop therapeutics and a way to battle COVID-19 while it's in the patient's body. So for that, I would like to talk about this company called Distributed Bio, which is one of the many companies that are working on treatment with antibodies. If you remember, the antibody is that molecule produced by the immune system that recognizes all the viruses. So their technology is based, first of all, in a computational antibody library. They have 5,000 antibodies that are ready to be tested. What does this mean? That when you throw a little bit of the virus, you can see with which antibodies it fits better. There is a good connection and a good interaction. After that, when they have a small number of antibodies that they can test, they are going to go to the second technology, which is antibody engineering. So they are going to produce many, many versions of this antibody, and then through computing modeling, they are going to see which one has a better response and a better solution for this problem. And they, of course, do it based on artificial intelligence. And this company has been featured, for example, in Netflix in the latest documentary of pandemics. And as you can see in this diagram here, we have three different ways on how to battle COVID-19 this year and next year. The first ones are related to repurposing drugs. So that means that all the drugs that were developed, all the medicine that was developed for malaria, for HIV, is going to be tested to see if they can also use it for COVID-19. And then we have in orange the treatments that are related with antibodies, like Distributed Bio. And then we have the development of vaccines that could take until September of 2021. So I don't have time for more. Of course, there is more technology, exciting technology we can talk about. I just wanted to put like a little summary for you here. And I want to end my presentation by saying that these concepts are not difficult, and we all as a community need to understand them to take better decisions for our governments and for our society. So all the different stakeholders like citizens, investors, policymakers should know a little bit more about this part so we can have a better discussion and conversation. Thank you so much.
Thank you, Clarissa, for this brilliant presentation. So basically what you showed was that technology is being used for different stages to deal with this, the treatment of this virus through manufacturing, through 3D printing, to diagnosis with CT scan and making prediction, and then for developing vaccines through different technologies, sequencing, computing, modeling, and as well as creating antibodies. Thank you very much for this. The next speaker, Ricardo Chavarriaga, head of CLARE and also a GCSP Associate Fellow, will talk more about the use of AI. Ricardo?
Yes. Can you hear me?
Yes.
Perfect. I hope you can see my presentation now. And I'm going to talk about the use of artificial intelligence in particular, very briefly, on the current situation against COVID-19. And I will start from the question of what do we want to achieve? What is the reason why we want to deploy this technology? And we can come back to this concept of flattening the curve. It has become a sort of universal motto in the responses to the current pandemic. And here, if we think about what is the concept of flattening the curve, is to reduce the spread of the pandemic so as not overload the medical capacity. So being able to treat people who get infected, and this is a way for us to remain under the constraints of availability on serviceability of the medical system, have say a workable pipeline of people who need a attention and people who can provide it, while at the same time we buy time for getting new treatments and getting a vaccine. So all this technology is going in these lines, and this underlines one concept, and is that the development of technology and the success of this technology depends on the way it is applied. In order to be able to flatten the curve, this technology should help making better decisions, having all the resources available in order to contain the spread, in order to provide services for people who get infected. And this is where the technological solutions have been oriented to. And as Clarissa mentioned, one of these first applications is to better understand the characteristics of the coronavirus. So we are, for the first time in history, probably living this pandemic in real time in the way we analyze the virus, in the way we analyze their spread. So the genomic came very quickly. We also know that this is a virus that can mutate very easily. So there's a need to rapid analysis of the structure of the virus as a way to signal potential treatments and potential vaccines. Having said that, the technology and artificial intelligence has played a huge role there on speeding up the initial phases of identifying candidates for these vaccines and treatments. Nonetheless, we always have to wait till clinical trials are performed in order to assess the efficacy of these potential treatments. And this is something where there is not much that the technology can do to speed up this assessment. So there is a technological limit on that. And this brings back again this the idea that the success of technology doesn't lie in the technology itself, but the way it is used and the way it is interfaced with the information we get from the human factors. Once we say have this understanding as one of the main axes of study, another line of applications of artificial intelligence is the monitoring the spread of the pandemic, initially as an outbreak. There were early warnings of that fast spread, and this was information that was recovered from news, recovered from sales of airline tickets, from official reports in the medical systems, as well as informal reports through social media. So there were many efforts that tap in natural language processing, in data mining, to find patterns of this spread, and this allow the community to identify early warnings about what's happening. And this is a very important aspect, because this can improve the readiness of the medical system or the political system to fastly react to the potential setting of the pandemic. Nonetheless, we have to be careful on the potential success of and accuracy of these systems. There are precedents of one particular case. 10 years ago, there was a system developed for this very purpose, to predict flu outbreaks. It was called Google Flu Trends. There was also Google Dengue Trends, that was trying to predict outbreaks based on searching behaviors. And at the very beginning, it was extremely successful, but then performance started to decrease, and it was not reliable enough, at least didn't fulfill the expectations. And there were many factors that influenced that. One of them is that people have different patterns of behaviors depending on whether it's a seasonal flu or something out of season. There are influence of the news and, for instance, about upcoming outbreaks that may bias the performance of these systems. And there is also the fact that these models were being updated through time, and there are not necessarily a good record of the lessons learned from these previous efforts, so that we building more and more reliable systems. So these are some of the things that need to be further developed in order of monitoring. And also we have the aspect of tracing contacts that we have right now. And I'm not going to enter into many details there. I think we'll come back later to that, and how can we monitor contacts between people, and this can help identify whether the measures, the preventive measures are put in place are being respected, but also may open the way for privacy breaches. We have also this idea of bringing novel ways for diagnosis. Was already mentioned the use of medical imaging and CT scanning. There are people developing techniques that are, for instance, based on sound, trying to see if infection can be decoded or inferred from the sound of coughing. And there are several groups working on this. These are concepts that are still require validation. And in the same way as we mentioned for vaccines, the overall accuracy and performance of these systems will only be known after it has been extensively tested in a large number of population. And this brings something that maybe particularly interesting here is the fact that the spread of the coronavirus has first touched the northern hemisphere and hasn't had yet that the same level of incidence in the southern hemisphere. That means that the models that are done right now for diagnosis and for monitoring and other applications may have an intrinsic bias depending on the people who have been infected so far and how these systems are validated. And this is something that needs to be taken into account when new solutions based on data science and artificial intelligence are put in place. And last but not least, we have this social interaction. There is one part that is really linked to the pandemic, which is the spread of information, the spread of misinformation, and the fact that by the very nature of the algorithms used in social media, these have an effect that tends to amplify information that has a shock value and it often may be fabricated or spread information that is misleading. And some other applications and consequences that are not directly related to the pandemic, but to the situation that it generates are the fact that we moved to movement restrictions, we moved to working remotely, to use extensively systems like this to communicate and to share information. And this creates a wealth of data that is additional to what we usually do. There are many, many services, many types of work that moved digitally right now. Some of them, say, were forced to update. If I think in the case of e-health, there were many services that were reluctant to adopt digital measures or digital records, and now there is more openness towards doing it. But if we do that without paying sufficient attention, this can open the way to provide data that can be used for different purposes that it was intended to or agreed to by the end users. So these are some of the consequences that the use of these technologies may have. And here we start entering a little bit of how can we contribute, but at the same time can create opportunities for misuse or abuse of artificial intelligence techniques. And all this development of technology is done in a particular context. It's a context where there is a sense of urgency. There is this idea of act rapidly, develop solutions at a fast pace, because we want to actually flatten this curve and contain the pandemic. But of course, this creates a tension with the proper validation of the solutions that we develop and the unintended consequences that they may bring. There is also a geopolitical context that needs to be taken into account when we talk about the use of technology. So who will be providing the technology, who's providing the data that allows to develop this technology. And this is done in a context where there are not well-defined governance framework of what can be done with the data, what cannot be done with the data, what can be shared and what cannot. I think this is something that needs to be considered. So how can we develop this kind of techniques is, of course, a huge question that many people are posing themselves. And as Clarissa mentioned, one cue is the involvement of different stakeholders. And I will add other ideas that have to be taken into account, like the concept of transparency, to be more clear, not only of what do we do with the information that we have and the data that we have, but also on the extent of which these systems have been tested, and the constant need to continue assessing the risk and benefits of these new technologies and be agile enough to adapt in case we see that the systems are not behaving in the way we expect or are not fulfilling its initial purpose. And for sake of time, I will stop here, and I think we can come back, of course, to these topics later in the Q&A.
Thank you, Ricardo. Apart from highlighting different ways, different stages, how AI could be used, I think the key takeaway is that you also raise awareness about the fact that it's not just all about technology, it's how we integrate technology with human being, with our practices. We need to understand also that data are not neutral, there are biases embedded in this data. And you ended by calling for building up a governance system that will deal with the issues of transparency, risk monitoring. Probably Ricardo Marcello will talk about that later. I now turn to my colleague, Robert Dewar, head of cyber security at the GCSP. Rob.
Hi, good afternoon. Thank you for convening this panel, and thank you also, Jean-Marc, for giving me the unenviable task of following all the good news that we've had about technology with now some of the bad news, with some of the concerns that are coming out with regard to the application of new technology and the creative uses to which this technology is being put. First off, it is really important that as many tools as possible are being placed at the disposal of experts in order to tackle the crisis that we're facing at the moment. But yes, as the harbinger of bad news when it comes to cybersecurity, I think there are certain important challenges that we're facing at the moment that come about as a result of the applications of new technology in new and creative ways, and certainly for technology being applied in a manner where it wasn't originally perceived that it would be applied. But before we get on to that, what we're seeing, and what I was asked to talk about rather, was not just the malicious use of technology in this current crisis, but how that technology is being misused, or how that technology is being abused, and the kinds of purposes to which the technology is being put. What we're seeing as one of the many unfortunate side effects of the COVID pandemic is an uptick in criminal activity based around new technologies. Cybercrime is on the increase, a basic point to make. And what I'm going to talk about is some of the operations that we're seeing and some of the kinds of tools and techniques that are being applied by criminals to achieve some sort of criminal gain. One of the most prevalent and simplest issues that we're seeing, and simplest in terms of the technology that's being used, is a huge increase in phishing emails, where someone receives an email that purports to be from a legitimate source and contains a link, and people are encouraged to click on the link to take them to an artificial website, or sometimes to no website at all. And those links are filled with malware, such as viruses, trojans, that then either exfiltrate data from the person's computer or take data from the network to which that computer is attached. What we're seeing is a great deal of artificial emails coming out purporting to be from governments, purporting to be from health organizations, COVID-related updates, for instance, with these artificial links that then plant viruses in people's hardware, but also artificial links to government sources, particularly sources that have some sort of information regarding welfare, assistance and support. We're finding that a lot of certainly in the UK, a lot of the phishing attacks or phishing operations that are taking place pretend to be from government agencies that provide some of this financial support either to individuals but also to professionals and to businesses. There's a huge campaign on the part of the government to support those people most at risk, not just from the virus, but from the social impacts and effects of the virus on their communities and on their everyday lives. And this is being leveraged, or this message is being leveraged in two ways. One, we're seeing people being asked to provide bank account details to artificial and fake organizations, but also we're seeing an uptick in companies being created purely for the purpose of applying for certain business loans and business support that the UK government is providing. We're also unfortunately seeing an increase in ransomware operations targeting the various medical institutions that are actually working very hard to combat the virus, and it's creating a great deal of problems from simply being able to operationalize what needs to be done from a medical perspective in order to tackle the virus. Ransomware, as we know, those in the business know, locks down computer systems, and in order to free those computer systems, you pay the criminal actors a ransom to enable you to use your devices again. And so not only is there a criminal act going on here in terms of seeking some sort of financial response, but you're also hampering the efforts of the organizations to tackle the virus itself. So these kind of opportunities are being taken advantage of by criminal actors, and the opportunistic aspect is very, very prevalent. We're also seeing websites that are being created that purport to be from legitimate suppliers of medical equipment and supplies, including personal protective equipment. Companies or institutions will phone this company, pay hundreds of thousands of pounds or dollars sometimes, and receive nothing in return because the company is completely artificial and was created for no other purpose than to extract some sort of financial gain. And we're seeing an increase, according certainly to to some of the agencies involved in tackling cybercrime. We're seeing an increase in the sale and spread of counterfeit medicines. So the problem is not just a technical one or a cyber one, but is increasing the problems of the society is facing. Now, there's 2 points, having listed all this terrible stuff that's going on, in addition to the global pandemic. There are 2 points that I would like to make on that. The first is that we're seeing an increase in the prevalence and occurrence of these operations and of this criminal activity. Malicious actors are taking advantage of the fear that people have about the virus itself, but also the what will happen next questions that people are asking. We've seen a lot in the news. There's a huge amount of discussion and debate about what to do next. What sort of strategies do governments have to A, combat the virus, but B, minimize the social and societal impact of the virus and the actions and activities taken to minimize the spread of the virus. In the UK, there's a great debate, or a very large debate around social distancing and the closure of businesses in order to prevent the spread. That's great, but the knock-on effect is a lot of companies and particularly restaurants, etc., are being put out of business as a result of the fact that people can't come to the business to spend money. So these sorts of fears and worries about not just the health future, but the financial future of the country are being preyed upon by these malicious actors. The second point I want to make, however, is that while we're seeing an increase in this activity, the activity itself is not a new problem. It's simply being exacerbated by the current state, the heightened sense of security and safety awareness that we have at the moment. And that's what's being taken advantage of. Phishing operations, people pretending to be legitimate businessmen in order to get people to pay for a service that doesn't exist, ransomware operations, or even organizations like the World Health Organization being targeted by state operators in order to try to gain access to those computer systems. Those challenges and problems are nothing new. The scale is, however, there's buying into malicious actors are taking advantage of this problem that we have today and ramping up their activities. And in the final kind of dying seconds of my presentation just now, I would like to point out that one of the things that Ricardo talked about was the use of new technologies and apps for identifying and managing the spread of the virus and how the virus is being spread by using artificial intelligence algorithms to do that. One of the questions that's coming up as a result of this is, how do you manage the security implications or the privacy implications of using data mining in order to track the spread? On the one hand, tracking the spread is hugely important in order to mitigate and manage the virus itself and the spread of the virus. But on the other hand, you have privacy concerns. Now, security versus privacy, data and information versus personal data, and the management of personal data, those are not new problems and not new concerns. They're just being brought to the fore as a result of their necessity through trying to deal with the coronavirus. And I'll leave it there, and we'll carry on with a bit more bad news from one of the other speakers.
Thank you, Rob, for highlighting some issues on when it comes to cybersecurity. If I try to summarize the way hackers and people with malicious intentions are acting is not really new. They just build up. They are using the fact that people are probably more in a psychological distress than they used to, and basically they are using that as their advantage through social engineering. But what is new is the scale, and probably has to do with the fact that more people have moved into digital means. It has increased the so-called attack surface of that hackers can use. Now, before we move to the next speaker, I will just remind our viewers that you can raise questions to the speakers, and we'll deal with them at the end of the presentation. You have a question and answer tab that you can use to ask your questions. The next speaker, Ms. Lenik Pedron, she is the president of ICON, an NGO based in Geneva. She will talk more about hacking. Lenik?
Hello, everyone. My talk will be focused on the impact of pandemic and the cybercrime landscape. Cybercriminals prey on the opportunity to take advantage of this surreal, it's really a surreal situation, and focus even more on cybercriminal activities. Try to deal with my presentation, so sorry. Cybercriminals have been among the most adept of exploiting the COVID-19 pandemic for the various scam and attack they carry out. It's very common, with a record number of potential victims staying at home and using online services across the world during the pandemic. The way for cybercriminals seeking to exploit emerging opportunities and vulnerabilities have for sure multiplied. We are in cyber attack sprint and in wave of misinformation. It's really a surreal situation because we are in cyber attack sprint and a wave of misinformation. I think it's a big point at this time. Cyber criminals show a strong agility. If we look at how they do their work at this time, they are very agile and they know who they can learn about our behavior at this time, and they are learning. It's not only for the spring at this time, it's not for the summer, it's not for this year, but it's for the 10 next year. We are fighting against two invisible enemies. Yes, because we have the virus on our physical area, and we have some cybercrime and misinformation on all the things in our cyberspace. So it's very difficult for our brain to understand what is going now. So just to make a parallel with the physical virus, we can show on the screen that our body is also shot by this kind of things. Our brain understands cyber attack like something very, very hard in when we have a visual part, our ears and a lot of things, because we have audio, we have a lot of things. Voice is very important too. And our emotion is very, very strange at this time. I make some lot of experiences in the NGO and in other area, in other communities, and I can see some pattern now about this. What is going now? We know that the impact of COVID on cybercrime has been the most visible and striking compared to the other criminal activities. Cybercriminals have been able to adapt quickly and capitalize on the anxiety and the fears of their victims. Ransomware has been some of the most dominant cybercrime traits over the last several years. It's not new. The current crisis is unlikely to change that dynamic. The pandemic may multiply the damaging impact of a successful attack against certain institutions like government, hospital, which reinforces the necessity for effective cyber resilience. The number of phishing attempts exploiting the crisis is expected to continue to increase. Now on the screen you can see a chart of this of today, and we can see the number of reports in the last day, in the last week, and in the last month. It's really incredible that at the end of April, cyber criminals learned and now try to exploit what they capture about us, about citizens, about government, about humans. However, we also expect a greater number of inexperienced cyber criminals to deploy ransomware as a service. So it's really easy to put that off. Not all of this campaign will result in successful attack due to the lack of experience and technical skills of this criminal. Phishing and ransomware campaigns are being launched to exploit the current crisis and are expected to continue to increase in scope and scales and DDoS too. Activity around the distribution of child sexual exploitation material online, I come back here, are very increased. It's a big problem. It's a big thing at this time. The dark web continue to host various platforms such as Marketplace. We show at the beginning of the crisis a big highlight on this, but now it seems to be stabilized. Vendor attempt to innovate by offering COVID-related product or something like that, but it seems like ever. Many attacks on critical health infrastructure happened. It's a very strange time, so it's normal. Cyber criminal carry out a cyber attack, for example, on Borneo University Hospital in Czechia. Since a state of emergency was declared in Czechia in March, the attack was considered an attack on a critical infrastructure. The incident prompted to the hospital to postpone urgent surgery and reroute new accurate patients to a nearby alternative hospital. The hospital was forced to shut down its entire IT network. During the incident, on two of the hospital other branches, the children's hospital and the maternity hospital were also affected. This type of attack during the public health crisis, such as pandemic, are particularly threatening and carry very real risk to human lives. Falsehoods about the virus are spreading widely on the Facebook messaging, on app, and other things like WhatsApp. I think it's very interesting to study it because maybe it's not only a one-time now. We will have, I think, other crises and we need to be ready. For example, Poland was hit by a wave of rumor about the government introducing zoning to cities and cutting off transportation to Warsaw. One audio message recorded by a man who claimed he had a journalist friend with close tie to political decision makers. The president will introduce an emergency state and that people would be able to leave their house for 3 weeks. Another case is in France and in Switzerland too. Users forwarded an audio message of a woman who said that she has a very, very, very well-placed uncle with ties to national minister or something like that, from whom she's got information that the whole country would soon be in very quarantine. In Portugal, a widely circulated voice message too suggests that information on the number of infected people in the country was downplayed by official sources, with a man saying, "Forget the number the television is talking about. There are thousands of infected people confirmed." In Ireland, some kind of pattern. This message are scaring and confusing people and causing real damage. I want to make a short apartheid, and I show you the WhatsApp message that I collected, because since the beginning of the crisis, I collected a lot of fake news, disinformation, to analyze them. And I have something to say about that, because we never know if it's for harm or fun, because at this time it's very difficult to be fun, to make things with humor. And it's the first time that the 1st April was quick, censored like this. It's an emergency, and we really need to work on this kind of things. Here you can see the fake of things arrive in France. It's a fake map of the day after. And we can see with the timeline of the crisis that we have on the beginning of the crisis some audio message, some pictures, some things like that, and after some more creative things like this map. I want to say another things about this, that without humor, our intelligence is not to test the test without seriousness. To live in harmony, we need humor. For our mental health, humor is essential. The lack of digital trust at this time, the ambient blur of the landscapes, the internet is leading us down a dangerous road. There is an urgent need to provide benchmarks to mitigate misinformation. Just another apartheid about contact tracing, because we work on it since 1 month in the NGO now with a task force about it. Just want to launch the discussion about there is 23 countries now who introduce it. 9 countries have used it. 12 governments has been imposed it, and internet shuts down in 4 countries despite the outbreak. So I think without trust, there is no society on the internet. We need to learn together our own cyber civism. Thank you.
Thank you, Lenik, to highlight that we're facing both a physical attack for the virus, but also a more informational attack through this infodemic. You highlighted that hackers are really good at learning and adapting, and that the use of misinformation is attacking one of the key pillar of our society, which is trust, and this has a strong security implication. The last speaker is Marcello Janca. Lenny, can you just stop sharing your screen, please? From ETH Zurich. Marcello.
Thank you, Jean-Marc. for the invitation and the kind of introduction. So I will not share slides because my task here is not to present a specific technology, but sort of distill the ethical implications of what we've talked so far, with special focus on digital surveillance. And Ricardo has already showed the main ways through which digital surveillance can be deployed, namely proximity and contact tracing, monitoring activities such as quarantine compliance, and providing mobility reports, as companies like Google are doing right now. But so from an ethical perspective, I will start with a trivial but I think important observation, and namely, it is certainly ethically challenging, especially from a privacy perspective, to use digital data for disease surveillance purposes, be it proximity tracing, contact tracing, quarantine monitoring, or other application. However, we should keep in mind that it's also ethically challenging not to use digital data if the processing of those data can help mitigate the contagion and save lives. So what we are facing here is a very complex moral dilemma. And the greatest challenge for us as researchers and policy experts, but also as societies at large, is balancing conflicting rights and ethical values. So I would personally argue that a certain temporary sacrifice of privacy rights can be ethically justified if it saves lives. So for example, if it reduces preventable deaths and new infections, and it is proportional to the public health needs that we're facing today, and leads to a faster restoration of other rights and freedoms that were temporarily interrupted due to lockdown policies, such as the freedom of movement and freedom of assembly. However, if we sacrifice some degree of informational privacy for public health purposes, in the name of digital disease surveillance, we need to be very clear about the conditions under which this trifling of privacy is allowed and for how long. So we need a clear expiry date and how privacy will be restored after the pandemic is over. I wrote an article with Professor Fibayena, which came out recently in Nature Medicine, which we suggest some basic criteria for mobilizing big data and digital technology, especially smartphone-based contact tracing during the coronavirus pandemic in a responsible manner. And this includes the principle of proportionality, the use of privacy-preserving technology, evidence-based approaches to tool development and deployment, and other requirements. However, in my short input statement, I would like to raise more general discussion points that I think encompass some of the discussions that we had so far. So one is the state of exception that we are facing today. Now, it's quite clear to political policy experts that epidemic response is a rare circumstance in which governments make quick decisions about the collective good, including decisions that might be in contravention of individual human rights. And this is results in what legal philosopher Carl Schmitt called the state of exception, namely sovereign state's ability to transcend the rule of law in the name of the public good. Especially during a time of crisis. And this can include the ability to diminish or supersede on constitutional rights. And other philosophers like Giorgio Agamben further investigated how this suspension of laws or modification of laws within a state of emergency or crisis can become a prolonged state of being. In which individuals are deprived of their rights. And now what we see during this COVID-19 crisis is that governments all over the world are already limiting some constitutional freedoms, such as the freedom of movement, freedom of assembly. They are permitting the expedited testing of treatments and vaccines. And I'm not going to say that these approaches are necessarily morally questionable. They are very well justified due to the public health crisis that we're facing. But there is a concrete possibility that the next logical step is indeed deploying pervasive mass surveillance regimes that can leverage novel digital tools. And this can be predicated upon the exceptionalism of the situation that we're facing. So digital technologies can be used as new mechanisms of social controls, and this can be introduced at an accelerating pace also bypassing the traditional checks and balances that might prevent them from being approved under less chaotic circumstances than those that we're facing today. It's important here to point out that there is never a guarantee that the civil liberties and digital rights will be swiftly restored after being taken away. And this is a point that historian Yuval Harari made very boldly in his Financial Times column recently. And we already have examples of this. The USA Patriot Act after 9/11 is a good example of a prolonged state of exception. And now we've seen also semi-authoritarian regimes like Orban's Hungary institution powers by decree without a clear cutoff date. So there is a high likelihood that the heightened digital surveillance technologies implemented during this emergency will remain, at least in some countries, even after the pandemic has abated, and they will continue to accelerate that process that we've been calling in the privacy domain the erosion of privacy, or even the end of privacy around the globe. And we have to be realistic because probably it's not in our power to eliminate this risk of privacy erosion. What we can do is probably help contain the extent to which this public health emergency will lower the bar of privacy worldwide. And this also leads to the second problem, which is the one that you, Jean-Marc, are an expert about, namely the problem of repurposing a dual use. So there is a legitimate risk that digital tracking could be used not only for tracking new infections, but also applied to other intelligence or surveillance. For example, one New York Times report found that Health Code, government-run Chinese app, technical support is provided by Alibaba, and that supports decisions about who should be quarantined for COVID-19, also appears to share information with law enforcement. So it is important for health authorities and governments to distinguish digital tools that allow this third-party sharing of information for non-health related purposes from those that do not allow that. And then there is the important topic of scientific validity and accuracy. So precisely because new digital surveillance tools are menace to privacy rights, governments or private companies should not be granted these surveillance powers unless they can show to the public how these powers would actually help in a significant manner to help or contain or mitigate the COVID-19 emergency. So efficacy should always be the first issue to raise in the deployment of these technologies and in their ethical assessment. Because if a proposed intervention is not efficacious, there is no reason to deploy it, because it's unavoidable negative effects on privacy and individual rights won't be compensated by any significant public health benefit. And for example, this is very important for big data, because if the digital tracking models, for example, are insufficiently validated, they might display high error rates, especially on the large scale, which in turn can be detrimental to public health. Imagine if you have a tool that sends the wrong people to quarantine and isolates those that should not be isolated, while letting freely circulate those people that should be in contrast be quarantined. And today we have no solid evidence that the collection of data using technologies like GPS is proven to be effective in tracking the spread of a virus. And we also have a long history of failures when it comes to digital predictions and tracing. Some of you might remember Google's flu trends that failed that misjudged the peak of the 2013 flu season by about 140%, so a big error rate. So scientific validity of digital tools must be proven and not presumed. Now, some people could argue that we have a sort of digital right to try, so that, given the extent of the current emergency, we must try everything, just in case a technique might turn out to be useful. And I would argue that this is both scientifically and ethically unjustified, because if the numbers of false positives, for example, and false negatives are significant, then we could have detrimental effects on public health, not neutral effects. And we can also divert resources and attention from more effective public health strategies that maybe do not leverage on digital, but on analog tools. And then, so there are three main risks from a more technical perspective. These are compelled and coercive use of digital surveillance tools. And we have already seen some applications of smartphone-based apps or other tools in which end users, so the data subjects or data generators, do not have the right and ability to opt out or to explicitly consent to their to the use of data. And this is, of course, a menace to individual and group privacy. And then there is also a problem of transparency, especially if the agreements, the data sharing and processing agreements are non-transparent, but also if the source codes are opaque or closed. So what I see here is general agreement growing at the EU level, but also beyond, that any digital surveillance technology, to be ethically aligned, should be non-coercive, transparent, open source, decentralized, and privacy preserving. And there are notable approaches, such as a pan-European project trying to develop a decentralized, privacy preserving proximity tracing app that seem to go exactly in this direction. And then on a very, very final note, I want to highlight, because we have been talking a lot about digital tools and novel technologies, but although digital tools can be of great benefit to public health, they will not spread the coronavirus alone, but only in combination with other parallel public health strategies. So from an ethical perspective, a global health ethics perspective, it's very important not to be reductionist, but pluralist, and consider that other strategies such as aggressive testing and ultimately the development of a vaccine are extremely important, because it is possible that by using proximity tracing apps, we can identify the movement and map people who have been infected with the virus or are at high risk of being infected with the virus. But then if we don't have large-scale testing capabilities, then we cannot test those people that the apps identify as at high risks. And if we cannot determine if these exposed people are actually infected, then this public digital health surveillance strategies are actually way less effective than they could be. So we need to keep this broad perspective in mind as well.
Thank you, Marcello. So it was quite dense what you talked about. You talked about a lot of different issues, but in a nutshell, basically, it's about advocating between the issue of privacy and proportionate measures to track this disease. That raises lots of issues in terms of delegation of access, who have access to data. Issue of deployment, what kind of application can we deploy, as well as the issue of reliability. You talk about false positive. Some viewers are asking for the reference of your article. You might maybe just mention the title of the article you just mentioned.
Yeah, I think I can also type it in the chat box, but it's titled "On the Responsible Use of Digital Data to Fight Against the COVID-19 Pandemic." And it appeared in Nature Medicine.
Right. We will put that reference in our website on the webpage of the webinar free announcement. Ashley, I turn to you now for the question. This time is running fast. We'll have one round of question and answer, and I will ask the speaker to be brief in your answer. Ashley.
Thanks, Jean-Marc. So thank you, speakers. My first clump of questions is directed to both Clarissa and Ricardo. How well have governments made this technology available, and where has the technology been used, misused, or ignored? And also, are there any unintended consequences or collateral damage to moving fast rather than accurately? Thank you.
Thank you, Ashley. Well, the companies that are developing the vaccines that I included on my presentation, two of them are funded by the Bill and Melinda Gates Foundation. There is not a disclaimer of what's going to happen with the vaccines after they are ready, but I will assume that since the focus of the foundation is in the global south, maybe they maybe they are offered to the global south citizens, but that's something that I cannot just assume, right? So I have been looking at the website where I was looking at the questions, and there is no information about it at the moment. So I guess we will have to wait and see, and also ask our governments what is their plan of action about it.
So here, I would say that it's still too early to know what the unintended consequences are, what are the technologies that actually work, and who took the right decisions. Marcello mentioned the fact that we need to have evidence-based decisions, but as the situation evolves very quickly, at the same time, we have a lack of reliable sources of information for many reasons. One of them is that it's a lack of coordination on how do we measure the current situation and the effects of the measures that are put in place. We see that the same data leads to different policies and different decisions across countries, but also countries changing overnight their stance based on apparently new science, while the science hasn't changed. So we have to embrace this uncertainty, and we have to be careful not to rush on the judgment of what are the good techniques or the bad techniques. We have to remain attentive and be able to do that, and it's definitely too early to identify what can be a good or a bad decision. There is a pattern that seems to emerge, is that there were certain countries that went quickly into extensive testing, containment, had a better overall response to this. This was also countries that already experienced large outbreaks before. So this seems to be a hint, but it's definitely too early to give a full assessment.
Thank you, Ricardo and Clarissa. I've unmuted myself. My next clump of questions is to Rob and to Lenig. There's a question about cyber hygiene or cyber protection. What do you think about teachers who are teaching online classes? Is there greater risk because they're more frequently online and available to be exposed? And secondly, a question about recovery and resumption phase. Will we see changes in cyber security policy, etc.? Thank you.
Okay, about the first question, I think we have no other possibility at this time. I think it's very good to use what kind of material we have. Maybe the question is about, for example, Zoom, because of the big scandal on it. We have a lot of discussion on it on the NGO with other experts. We think that yes, the cybersecurity maybe is not very good. Zoom make some error about this. But we are sure on one thing: trust is very important now for citizens. It's a really big changement. And I think it's very good to use good material and useful for the course. Security is very important for sure. Privacy is really important too, but we really need to use it because if you have, for example, bad tools, you can make a good course. So it's really like that. And the second question, maybe Robert, you want to answer on it? No? Okay.
So I can jump in there if you want. Yeah. Yes, thanks. This, just to follow on exactly from what Lenig was saying about teachers and online classrooms, I think we all know the example that is being referred to obliquely in that question. And just to reiterate what Lenig was saying, that we have the situation we're in now, and we have certain tools, and we need to use those tools to the best advantage in order to continue in as much of our normal life as possible. But as with any new technology and any new device, and any device where there are concerns, or any facility or platform where there are concerns, it's how you use it that becomes the most important part. There are certain concerns with online video conferencing, but if you put in certain protocols and procedures to mitigate as many of those concerns as possible, the problems can be reduced, not eliminated entirely, but can be reduced. So it's how you use it. If you're concerned about privacy, one of the biggest problems you've got are these things. These are vectors for privacy breaches, yet everyone has these. So it's how you use the tool that is most effective in that. And you know, there are passwords for this particular meeting, etc. So it's how the tools are managed. The question that we had about what will the post-pandemic landscape be regarding cybersecurity, I'm not a futurist. I don't look to what's going to happen later on. And I certainly don't want to predict or proselytize on what's going to happen later on. But I will raise one concern, which is that at the moment, for obvious, legitimate, and understandable reasons, more and more information, more and more data, more and more capacities being given over to artificial intelligence, to particular organizations and private sector entities that have particular capacities and capabilities to deal with particular aspects of the information that is needed in order to combat this particular virus. Also, there's more steps being taken by local, regional, national, international law enforcement and bodies to do things like maintain social distancing and encourage social distancing. A concern I have is that we go so far down that road in terms of enforcing, for example, enforcing social distancing, that it could be problematic trying to then step back to where we were before all this kicked off. How do we get back not just the question related to businesses and small and medium-sized enterprises, but I think this question speaks to a much larger problem of coming back to the status quo before COVID-19 struck. How can we then claw back the civil protections, for want of a better word?
Thank you, Rob and Lenig. The final question is to Marcelo. A question on digital surveillance and monitoring. How can we use these ethical guidelines mentioned in your presentation and impose them on companies, especially for-profit companies? Thank you.
Yes, it's a big question. We need to understand, sorry, yes?
Sorry, the question is to Marcelo. Thank you, Lenny. If we have time, I'm happy to have you answer, but let's have Marcelo answer first. Thank you so much.
Well, I have to concur to say that it's $1 million question, especially the part about the enforceability, because most data ethics guidelines we have today are soft law governance. So they are not binding, but still soft law seems to have quite some important impact in shaping the practices that digital players adopt internationally. We have seen this with AI ethics guidelines, for example. I have to say that we have seen positive developments in the private sector domain. Lately, many of you, who are on this video conference might be familiar with the unprecedented partnership that Google and Apple have established for the development of a proximity tracing tool. And I think, you know, we have to welcome this initiatives because the digital infrastructure required to enable this degree of digital surveillance that we need for the current pandemic is massive. And this is unlikely, we can unlikely be able to leverage this digital infrastructure without working together with the big tech players. And there is also a pragmatic reason, namely if everyone develops their own app, and then this app has a very limited number of people who download it, then the public health impact would be extremely low, if not negligible. So we need to leverage on large-scale digital infrastructures and avoid to reinvent the wheel every single time. So these companies can provide the adequate digital infrastructure. But I think one very important ethical point was made by the Italian data protection authorities, which is among the many data protection authorities internationally, the one that had to face these questions quite early in the pandemic, since Italy was the first European hotspot. The authority claimed that private companies should be the enablers or facilitators, but not the ultimate decision makers of public health campaigns and public health strategies. And I think this is a very important point. So they can provide the digital infrastructure and the tools that are necessary to make important public health decisions, but they should not make the public health decisions themselves. And we need to implement criteria to ensure that the processing of data and the collection of data that they enable is compliant with ethical principles. For example, having a clear expiry date about when the data will be stored and processed, what kind of decentralized and privacy preserving technology is used, and whether there will be an independent audit of their APIs and other relevant information.
Well, thank you very much. I know we're a bit running over time, and we have received more than 40 questions. Obviously, people will be frustrated because we cannot deal with all the questions. But there is one question that is very important that has been raised, and is being raised again and again in different workshops that we held in different conferences at the UN and elsewhere. Has to do with trust, the issue of trust. How can we build greater trust and confidence in the technology that we use, given the frequency of this information? This is very important. So I would, if each of you could give your 2-cent answer, but very quickly, about how to input, how to raise, increase trust in technology that we are building. Clarissa, we start with you. Try to be brief, please.
As a scientist, my recommendation will be to all my fellow scientists to use science communication as a bridge to make citizens understand about the pros and cons of each technology. Thank you.
Ricardo?
Yes, well, my opinion is that the first step to make organizations willing and eager on building trust is to show that trust has a meaning to the overall society. So that despite many scandals regarding the use of data, there seems not to be enough uptake in the general society of what does this mean, and this is in part a failure of communication and enhancing scientific literacy and digital literacy on what this actually means, so that all stakeholders really work together to make this trust an important asset of any organization.
Robert?
Be very wary of information coming from unregulated sources on social media. In the past, messages have come out that, before social media, before the internet, if the government produced a message and you didn't trust the message, and that said more about the nature of the government and whether you trusted the government or not. But now, social media is great for so many things, but because anybody can say anything, there's far less moderation and far less trust in the kind of messages that are coming out, and more messages are coming out that are untrustworthy, and that's becoming problematic now.
Right. Thanks. Lenik? Unmute.
Yes, the digital respect is on focus, I think, to develop trust about company, like we can see with Zoom, for example, but there is a lot of example with Facebook and other things, and about user, so about citizen, about us, about human. I think we need to work on a digital respect, and it's very important at this time to understand what is digital respect. Yeah, I think it's the best way to go.
Thanks. And finally, Marcella?
Well, as a scientist and an ethicist, I would probably say only two words. One is science, the other one is transparency. So people trust technologies that are grounded on sound scientific evidence, and we need to show the evidence. And the other one is transparency. The only way to respect the autonomy of people is not treating them as passive data generators, but as active decision makers. And there is plenty of evidence that shows that if people are adequately informed about the functioning of a technology, the reason why that technology is deployed, why we are collecting data from them and for which purpose, then people are willing to participate in public health campaigns, they're willing to use the technology, and they're willing to share their data. So we really have to be transparent about technology use and data use and avoid secrecy.
Thank you. Thank you very much for all your brilliant insights. I think it was a very interesting tour d'horizon about the issue of the use and misuses of technology in a time of a coronavirus crisis. Stay tuned with us. This was episode 3. Next week, we'll talk about the impact that this crisis has on global terrorism and violent extremism. Although these organizations are also affected by the same kind of dynamics that we are all going through, some are actually using that to their benefit, and we'll talk more about these issues with a reload panel of speakers next week. To follow our activities, you can log on our website, gcsp.ch. You can watch this webinar and other on our YouTube channel. And until next week, be safe, and I'll see you in a week to talk about the impact of this crisis on global terrorism and violent extremism.